All right, everyone, let's pause here for a moment and talk about the patient we're focusing on today. This patient has a diagnosis of chronic obstructive pulmonary disease, or COPD. COPD is a progressive lung disease characterized by chronic airflow limitation. The two main components are chronic bronchitis and emphysema, and both contribute to impaired gas exchange. When you're assessing a patient with COPD, some of the key signs and symptoms you should expect to see include chronic cough, often productive, shortness of breath, especially with exertion, wheezing or diminished breath sounds, prolonged expiratory phase, use of accessory muscles to breathe, barrel-shaped chest in more advanced disease, fatigue and decreased activity tolerance. You may also notice low oxygen saturations at baseline, but remember, these patients often live at lower oxygen levels than the general population. For this patient, our treatment focus today will be maintaining adequate oxygenation while preventing respiratory depression. Interventions we'll be implementing include controlled oxygen therapy, typically via nasal cannula bronchodilators, such as short-acting beta agonists or anticholinergics corticosteroids, if ordered, to reduce airway inflammation, encouraging effective coughing and deep breathing, positioning, such as high Fowlers, to improve lung expansion, monitoring respiratory status closely, including respiratory rate, lung sounds, and oxygen saturation. It's especially important to avoid over-oxygenation in COPD patients, as this can blunt their respiratory drive. As we go in, I want you to focus on respiratory assessment. Listen carefully to lung sounds, observe breathing patterns, and note how the patient tolerates activity. Ask questions, think critically, and remember, our goal is to support ventilation, not just oxygenation. All right, let's head in. Just tell me how you're using Samantha next.